Good day, Mr. Chairman, members, all CFS patients still suffering. I'm Robert Miller, a 25-year CFS patient from Reno, Nevada, along with supporting patients. I first would like to ask, as Dr. Jason said earlier, he was impressed with input from ex officio members. I would ask that we would get more input from the ex officios. And it may just be my perspective, but we're into the second day of meetings, and I know yesterday was science, but there has been almost zero coming from the ex officios, at least, again, from my perspective. I'd like to start today with a message to NIH Director Collins and NIAID Director Fauci that we patients began emailing to them last week. Dear Directors Collins and Fauci, what have you done for ME/CFS today? Patients and families are waiting. The directors have received over 1,500 emails over the last week. They've gotten additional faxes and phone calls as well, asking this particular question. And you, the patients, and the patients here should be commended for that action. I want to read an example of one email that was sent. It only had this person's name on it, and the email went. It took me 40 minutes to get one message sent. When my energy returns, I'll send the second message. Finally, something I can do to help myself. Thank you. I think that says a lot. I'd like to report to you about a meeting I was able to set up with the NIH just prior to the recent XMRV conference, along with some other patients. We met with Deputy Director Gottesman, 9 of his patients, and CFS specialist Dr. Daniel Peterson of Nevada. We presented 2 petitions, one signed by over 1,000 patients in protest of the controversy that let the CDC publish its inability to find XMRV before the NIH FDA study confirming MLVs in CFS patients was released. The second petition was from Pandora, and they had over 1,600 signatures requesting a meeting with Secretary Sebelius. At the NIH meeting, we laid out 5 key points. 1 was trust building. We're watching NIH's commitment to CFS research very closely. 2, NIH needs to earmark $100 million to CFS research to make up for a poor funding record, and it should establish an expedited funding and research process just like it was done with AIDS. 3, NIH needs to fund centers of excellence. We've heard it said today, yesterday, last year, the year before, the year before. It is time to get these centers funded, up, and running. And we have the facilities there. They just need money to be able to move on. 4, NIH and FDA have to seed clinical trials for treatments. The FDA's long inaction has paralyzed the drug development, leading to the AIDS effect, where patients are self-medicating with serious medications such as ARVs, because there's no other treatments. None. And excuse me if I get your name wrong, sir, but Dr. Cavelli-Cole, how is it that the FDA is still playing the safety issue game in regards to the drug Ampligen? I clearly don't get it. 5, pediatric study care and care is non-existent and needs to be addressed. Our meeting at the NIH was respectful and laid out our concerns as patients in a way I doubt the NIH had heard at that level before. Both sides agreed to meet again in 3 months to assess the progress, which leads to my request today. CFSAC's made core recommendations to the Secretary of Health for years, some repeatedly, and it's time for a response. No Secretary of Health, previous or current, has even acknowledged CFSAC's recommendations. It's time for Chairman Snell to request a meeting with Secretary Sebelius, along with each subcommittee chair, to get her response. And I mean a face-to-face meeting. I'm not talking about some dog and pony show. Some on this committee are new and need to be brought up to speed, but you have to keep the ball moving. This committee cannot start from scratch again. CFSAC's recommended Centers of Excellence changes the funding and variable recommendations prior, and specifically accountability at CDC, where you accomplish a huge step in the removal of William Reeves. We patients are demanding that Secretary Sebelius honor your hard work and honor the decades of suffering of CFS patients by replying to your recommendations with concrete answers. And we patients support you in that effort. And it's time to capitalize on these historic findings and solve our long, long agony. The buck stops with Secretary Sebelius. We patients won't wait much longer. I've been able to return to D.C. for this meeting and the NIH meeting only because of Ampligen. Lastly, if federal staff tells you you can't get a meeting with the secretary, do it anyways. That's what I did, and I was able to get a meeting at the NIH. Thank you for listening to me today, and I thank you for what you do for ME-CFS today. Thank you very much.
Thank you, Robert.